Okay, so it's lovely to see you all. Thank you so much for coming. It's saying my internet's unstable now. That's because there are so many of you, I think, here all in one go. It can only cope with so many people. But I would like to introduce Dr. Shrikant Talari. He is here with us today from India. And well, I will hand you over to Shrikant, and he can explain to you where he works in India and who he's working with, because he's a busy homeopath in a really busy practice. Shrikant, over to you.
Hello, everyone. Thank you, Mary, for that good, nice introduction. So I'm a homeopath from India. I practice at a center known as Prana in India. It's a one-of-a-kind center where we have various specialty OPDs. So I specifically have my specialty related to cancer. So I have some very good results, and I feel this session is to share our knowledge and experience with the world out there, and basically encourage people to have that same kind of results in their practice. So I'm going to show today 2 or 3 cases, and through these cases I want to show you the methodology of what it requires to be a good, confident prescriber and a successful prescriber. So let me begin with my PowerPoint presentation. And okay. Okay, so when we is my PowerPoint visible to everyone? My audio video is clear?
Yep, it's good, Shrikant.
Okay, good. So confident prescribing. So yeah, someone, if you can, everybody please mute yourself. It's like
I do need to
everyone,
let it.
please mute yourself.
I leave it going because it's webinar.
Heli, can you please mute yourself? Yeah, Mary, can you mute her? I think she is not able to hear.
Recording in progress.
Okay. Okay. So when we talk about echo. I think Mary, you'll have the host mute everyone except me. If you can do that. Okay, thank you. Am I audible now? Just do a thumbs up. Am I audible? Yeah, okay, good. So when we talk yeah, everybody else is muted, only my voice is now coming. Yeah, okay, good. So when we talk about confident prescribing, there are 3 essential features to it. The first is knowledge of disease, knowing what you are treating. The second is knowledge of medicine. Medicine meaning our materia medica, repertory, kingdoms, miasms, drug pictures, so many different types of knowledge of medicine we have, right? And then the third is the art of knowing how to apply the knowledge of medicine to knowledge of disease. So I would like to share the importance of each of this quality by giving a case example. So let's start with the case, and through this case, I will be highlighting the knowledge of disease, how it is important to know what we are treating. Correct? So this is our first case for today. This is a case of a 40-year-old man who has the following complaints. His main following complaint is sleepiness, drowsiness. This is one of the most intense forms of drowsiness that I have seen. This man is so drowsy and so that while he is narrating symptoms also, he feels like going to sleep. He is so drowsy that while he is driving his vehicle to the office, he will fall asleep while he is driving. He is the driver. Imagine. When there is an office meeting going on, in that meeting, he will fall asleep. So he says that I cannot sit down for 15-20 minutes. If I sit down for 15-20 minutes, I just start feeling like, and then I fall down. And then when I fall down, I sleep with, like this half open eyes. And then after 15-20 minutes, I feel like, I'm having pain in my calf muscles. I'm not able to wake up. And then I see, oh, I slept. Right? So that is his most intense symptom. His second symptom is he has nose block and he wakes up at night with this and he wants open air. So he goes beside the windows and has some open air with which he feels slightly better. Along with that, he has constipation with tightness in abdomen. Like this, there were many symptoms. And I used to repertorize all his symptoms, right? So I will just show you the repertorization and what were the other symptoms that had come up. So one more symptom was obesity. He was very obese, 40-year-old man, very obese. He said, I feel very strange. I have a double chin, my neck is reducing. I have a lot of fat. I'm becoming obese. My tummy is large. Then narcolepsy, sleepiness, snoring during sleep. And then in the mentals, he said, I feel like, I'm very egoistic. I said, what do you mean by that? He says, in my family, if there is a conversation going on, and if someone says that, that relative of ours, he's doing well, he's earning well, he's doing well for himself, then I get very angry. I said, why are you talking about him in front of me? And I become angry. And I said, I know better. You don't teach me what is success and all that. I don't like, I start feeling jealous of people that they are doing well, that they are successful. People are talking about this. And I tell people that I am better. I know better. I don't teach me. I know what to do. I know what not to do. I know how to get success. Right? So looking at this drowsiness, sleepiness, egotism, jealousy, I gave him opium, right? It did not work. Okay. So then what I did, I took some more symptoms. Then I took stomach, gases, fullness, constipated, nose block at night, and then angry, irritable, and I gave him Nux vomica. Nux vomica, he did not do well. Then I gave him sulfur. I am better. I know. Egotism. You don't teach me. Jealousy, competition. I gave sulfur. No relief. So like that, I gave him many remedies. Then there is one more symptom. Perspiration is eating while spicy. If you read perspiration on face, then one of the top remedies is Nux vomica. That is also one of the reason I gave Nux vomica. I know better. That is sulfur. He cannot hear the praise of another person. One more symptom he had was, I feel that I am losing my position in my job, because I feel that, the younger generation that come, they are more smarter, they have more knowledge, they are more quick, they are willing to work more than I am willing to work. Now, because of my age, I don't have that kind of stamina, but they are willing. So I feel the company will feel that, younger people are performing better, so let us give them the opportunity. So then maybe I will lose my manager post, I will lose my position in the company. So I'm scared that they will come from behind and they will take away my position. So that is one more symptom that he had, right? And then I kept trying. I thought maybe this is some, if some of you know the concept of periodic table, and losing your position is in the right side of the periodic table, losing your job, right side. I gave some remedies like gallium, etc. Now, interestingly, this patient did not do well even on that, because obviously gallium did not have that kind of sleeplessness, etc. So for me, it felt like nothing is, falling into place. I'm trying so many repertorizations, I'm trying so many materia medica references, I'm trying so many kingdoms idea, themes, all different avenues I've tried, but nothing is working. So that is when I thought to myself, maybe I should first try to understand what is needed, what is to be treated in this disease, what needs to be actually addressed, what is it, what disease does this patient actually have. So thinking on these lines, I thought, which clinical condition or which disease can I think of which has nose block, hypertension, etc. So I just put this in Google search on the internet, and I said, show me diseases which have nose block, hypertension, obesity, etc. And I kept reading various websites, right? One disease that came up very prominently was sleep apnea. Okay, and then sleep apnea is patient has nasal obstruction. He wants to go to sleep, but as he falls asleep, there is nasal obstruction and he wakes up. And because of that, the sleep is not complete and the patient is sleeping the whole day. Now, what becomes more interesting is if you read this, who are the people who are at risk of sleep apnea? People who is a male patient, very good, our patient is male. Who is obese, who is overweight, our patient says, I am overweight. Who is above 40 years of age, our patient's age is 45. Who has large neck, our patient is repeatedly saying, I have double chin, my neck is enlarging. Who has obstruction of nose, whether in the form of tonsils, tongue, etc. And there is family history of sleep apnea. Our patient did not have family history. Nasal obstruction, deviated nasal septum. What is more interesting? What are the associated diseases? Patient develops hypertension. Our patient also has hypertension. Yeah, you remember this slide? In the first slide I had written, patient also has hypertension. So everything started to fit. Nose block, hypertension, obesity, everything. So I knew. Now what I knew is what needs to be treated in this case is nasal obstruction. Do you all agree? If his nasal obstruction improves, if his sleep apnea improves, most probably all his complaints will go. Yes or no? Because that seems to be the origin. Correct? Yes. Can anybody type in the chat so that? Thank you. Why? Okay, thank you, Nicole. So I knew that what needs to be treated is nasal obstruction. Then I put my complete focus on the nose. I said nothing else I want to listen. I don't want to listen about your stomach. I don't want to listen about your hypertension. I don't want to listen about your obesity. Just let me understand your nasal obstruction. Tell me every single symptom of your nasal obstruction. I don't want to hear anything else. And then he repeatedly kept saying one thing, that with the nasal obstruction, I feel drowsy, sleepy, and I sleep with half opened eyes. I never sleep with completely closed eyes. And then one of the remedy which has this kind of nasal obstruction is lycopodium. And then when you read lycopodium, you will understand that it sleeps with half opened eyes from Clark's Dictionary of Materia Medica, sleeps with mouth open, nasal obstruction, especially at night, which prevents respiration except through the mouth, stoppage towards morning, evening, child's breath often stopped in sleep. You see, for 15 seconds, even when mouth is open. And then suddenly I understand that even though I am coming to lycopodium from this keynote symptom, I suddenly come to know that lycopodium is also a remedy for gases in abdomen, constipation. Yes. Lycopodium is also a remedy which feels that my position is in threat. No, lycopodium's drug picture is what? If you read Sankaran's Materia Medica, the drug picture, and let me just read for you. So if we read lycopodium, you see, first thing, it is known as the vegetable sulfur. That is why the egotism, the pride likes sulfur, no? And this is what is the drug picture. I have been told that several thousands of years ago, lycopodium was actually a huge tree, and that over the years it reduced into a small fern. The main feeling in lycopodium is that if the person remains small, his survival will be difficult. He will be humiliated. He will be nowhere. The main theme, therefore, is ambition, desire to grow bigger, lot of effort, which is fully concentrated on becoming bigger, powerful, reaching a higher position, a top rung of the ladder. And then their main feeling is someone from behind will come and they will take up their position. Their stability, their security. You see, that is why we were feeling that this is to do with job security, fourth row issues, etc. You know, house, family, source of income, good health, protection, stability. Right? So suddenly you see the mental symptoms also start to fit in, the drug picture also starts to fit in, the other physical symptoms also fit in, nose block, obesity, obstruction, gases in abdomen, etc. So based on this, I gave the patient lycopodium. And after initially he was given a dose of 30, later on I gave him a dose of 200, and actually with 200, he started doing really well. His blood pressure started to come under control. His nose block went away. His stomach started to improve. He started to feel fresh. He has stopped feeling so sleepy. He does not sleep while driving, etc. Right? So overall, he started to do well. Now, why I shared this case with you is you can see from this case now that how important it is to know what we are treating. No, it's not always just enough that we keep saying that if we get the keynote, everything will be solved. If we get the right symptom, we will know or we will give the right remedy. But to know what is keynote, many times we have to know what is the disease. Without knowing what is the disease, it is very difficult many times to know what is the keynote. Without any context, it is like a jungle. We are lost in the jungle. So many symptoms everywhere. There are symptoms. What is important here? Which is that symptom on which I should base my symptom? And why is this symptom most important? That background clarity will come if we first know what is the disease that we are treating. This is what I wanted to point out from this case. Did you get everybody? Yeah? Can you please reply, show some thumbs up or something like
Shrikant,
that?
can I ask you a question?
Sure.
Can you hear
Go
me?
ahead. Yeah, I can.
So, in terms of this, the etiology of the sleep apnea, were you able to get any information which suggested that it started at roughly the same time as the nose block?
Yes, both started simultaneously. You see, I skipped that part because I wanted to, share more cases. So you see, during case taking, I asked about the origin of the case. There was no cause, especially in chronic cases. Then you look for ODP, and the first symptom was nose block.
Sorry, what is ODP?
ODP is onset, duration, progress of the disease.
Okay.
What was the first symptom? Since when is it happening? What is the duration of the symptom? And from the first symptom, what is the progress? First was nose block, then you had what? Then I had obesity, then you had what? Then I started having stomach complaint. Then you had what? Then I had this hypertension. That is the progression of disease. Okay. So the idea is to first mainly focus on the point that I want to deliver, correct? So is this point clear? The first point for confident prescribing is to know what disease we are treating, right? So now let us go to the second point, that is knowledge of medicine. We should also know our medicines properly, correct? So let me share a case example for that. Okay. Okay. So this is a case of a 70-year-old man who comes with prostate cancer, and he has metastasis in his hip joints. And he's told that you have prostate cancer, you have to be careful. I think you should start from chemotherapy, get your surgery done, etc. And he says, no, I don't want to do all of that. And I am not scared of this cancer, etc. My only problem is I'm not able to pass urine. I have anuria. Anuria basically means you are not passing urine at all. He was passing only few drops of urine in the last 24 to 48 hours. And that is causing me a lot of pain and discomfort. That is my main problem. If that is solved, I'm okay. I'm not going to bother about this cancer. I'm not worried about it. So how did this anuria happen? I see, doctor, I usually have a history of having recurrent kidney stones in my left kidney. He has always had left kidney stones. Every 2 years, he gets operated and gets his left renal calculi stones by laser. He used to crush them. So he thought that this time also I'm having pain and I'm having difficult urination. So I thought they will say again, you have kidney stone, we'll operate you. But this time they said, no, you don't have kidney stone this time. This time your prostate is enlarged. So we'll just slightly scrape your prostate gland and you will start passing urine. So he went for the operation, and after the operation, they found out that he has cancer and that The scraping is not enough. They have to completely operate, etc. And he does not want to operate. That's when he comes to us. He passes urine now with only a few drops, that too with a lot of difficulty. He has no fear about cancer, etc. Somehow, no, PPT is not working. So then one more physical symptom he had is, because he was training for this urination, along with this training, he used to really bend forward and touch his forehead to the ground, so that he could put all the pressure on the bladder to get out a few drops of urine. And that is the only way he would be able to pass urine. Some of his mental symptoms are, firstly, we see he has no fear of cancer, no fear of suffering. Very strange. Generally, cancer patients, they are scared. Oh my God, I have cancer. What should I do? Should I take this treatment? Should I take that treatment? When is my surgery? Do it tomorrow. That's what a common cancer patient does. But this is unusual. I don't care. I'm not scared of it. Just get my anuria out. That's all. I'm not going to get a surgery done, nor even a chemotherapy. Very, very restless. He says, I'm very restless. I cannot sit in a place. I'm constantly working. I like to constantly keep on working, so that, I don't feel restless. I said, what do you mean by this? So he says that, if I sit alone, I get anxious thoughts. I get thoughts about, oh my God, what must be happening? I have a towing business. What must be happening? My towing van has gone to pick up that car. What if the towing van meets an accident? What if the police catches them and asks to pay a fine? Oh my God, I feel anxious, and I start feeling restless. I start walking about. I don't know what to do. I don't get sleep till all my towing vans come back to my garage. Till they are not there, I feel so restless, very anxious. And or I get thoughts, there's so much of suffering in the world, so much of pain. The other day, doctor, I was outside, I was walking on the street, and I saw a bus coming. That bus hit a man, and then the driver got scared. He ran away, and this guy, he was just lying down there bleeding, and no, everybody was just watching like that. I said, what are you people watching? This man is bleeding. I shouted, yelled at people. I said, you have to be sympathetic, you have to take care of people. I picked him up, I put him in the hospital. Then I went, I chased that driver, I caught him, handed him over to the police, etc. So, and I feel so bad. How can people do like that? I feel so bad for people's suffering. And I really want to take care of them. I feel sympathetic. If I see anybody hurt on the road, I feel very bad for them. So this sympathy is so much that, once there was a dog on the streets, and it was a street dog, and it was raining heavily. So he told his family, it's raining heavily, there is a street dog outside, we have to get that street dog inside. And then he wrapped that street dog in some very warm clothes, gave it some hot milk to drink, took care of that street dog for a day or two till the rain stopped. And once the rain stopped, the street dog ran away. It was a street dog. Then he got very disturbed. He said, this street dog does not understand. Today evening it's going to rain. What will it do? So what he did, he asked all his family members, go and find that street dog, because it will die. Today it will rain, and in that rain it will die. It should not happen. I have to take care of that street dog. And they had to literally go and search that street dog. So that is how he feels. He had a maid, and that maid, while she got married, she went about 8 hours away from their house, and he was talking to her on phone, and suddenly the phone got cut. And he said, I think her husband is hitting her. How could she cut the phone? Something is wrong. Her husband is hitting her. So he said, all our family, we have to go and search that maid. We have to save that maid. Her husband seems to be a violent person. The family begged and pleaded. They said, let's wait for 12 hours at least. If she does not call back, then we will go. Luckily, exactly after 12 hours, the maid called. She said that, that while I was talking to you, I was on the street and someone from behind came and they stole my mobile phone. So since then, I did not have a mobile phone. I could not contact, I could not call. That's why I didn't, it was abrupt call. Then he pacified. So that is the amount of care, anxiety, affection that he really feels towards others. And he constantly wants to work. He constantly wants to be busy. So one instance is that he was working in a factory as a driver. The factory has 8-hour shifts as drivers. His problem was, after 8 hours, I don't know what to do. I can't go home. I feel restless. I feel some accident is going to happen. Something is going to happen. So might as well I drive a car. So I used to search, who is absent today? This guy is absent today. So I will do the next 8 hours duty also. Now the next 8 hours is also over. Now what to do? I can't go home. I feel restless. So again, I will search someone. So once it so happened that I did duty continuously for 72 hours. Imagine 72 hours, one after the another, one after the another. He kept doing someone else's duty just because he did not want to go home. And the last shift where he was supposed to pick up a international delegate, he was standing at the airport with that placard and he just fainted there. No sleep for 3 days. No, he fainted. Then the international delegate, he got very scared. Something is wrong. He informed the company owner that your driver is like this. Then they came to know that this guy is dangerous. He just keeps wanting to work and work and work. So then my work was cut off. They said after 8 hours, he's sent home. No extra duties for him. So that is the amount of restlessness, activity, sympathy, anxiousness that this patient feels, right? So now, let us have a little bit of interaction. I've spoken a lot till now. So from this description, what will you do? What are your thoughts? What symptoms can we take? What remedies come to your mind? Yeah, if anybody.
Lisa here. I was thinking about one physical, the recurrent kidney stones, and one emotional, this kind of hysterical anxiety, and both anxiety for others and also anticipatory anxiety. So those are the two things I was thinking about.
Okay. Yeah. Janja, you said causticum. Can you please tell me why you felt causticum?
Oh, hi, I'm in a public place. So I see it as, so I can't put my video. I see it as affinity to bladder, urination, and just the kind of sensitivity to other people's feelings.
Okay. But does causticum have that kind of restlessness?
Well, indeed, yeah.
Huh?
It's just a really quick thought that I share.
Yeah. Anybody else? Yeah,
I would think arsenicum for the restlessness and the worry about others. mainly, and I guess it can affect any part of the body. So it's kind of.
But tell me, Isabella, will arsenic be so cool if he has cancer? Will he say,
no,
I
it would worry about the cancer. It would worry about the cancer. Yes.
he would be terrified, petrified. Oh,
Yes.
oh my God,
Yes.
I'm going to die. Do something immediately. Yes or no?
Yeah. Yes, it would.
But this guy is so cool.
Because it's
I don't
worry
worry.
about.
I don't care. What is this cancer? Actually, he said something in Hindi. He said, "Jo dar gaya, wo mar gaya." Means the one who is scared is dead. Those who do not, those who are not fearful, they don't die. So if I get scared of cancer, I will die. That's what he said. Iodum. Yeah. Why Jamja? Am I pronouncing your name right? Jan.
Thank you for asking. It's Jan, yeah.
Yeah. Why
Just
iodum?
this intense restlessness.
Restlessness.
Yeah.
Yes. Activity, restlessness definitely fits in with iodum. But the other symptoms of iodum, mainly the metabolism or the hot feeling, no, that is missing. Or the sympathy aspect. Iodum is not known for so much of sympathy, no? Worry, sympathy for others. Right? So you see, similar thought process I am also going through. I also feel causticum. I also feel, okay, should I go with some local remedy? Maybe I think of ferrum picrata or sabal cerulata, or should I think of sympathy, so causticum or cocculus or some other remedies. But you know, something or the other is missing. If I think of causticum, sympathy is there. Okay, little bit of urinary symptoms are there, but no, anxiety is not causticum. No, causticum, arsenic, too much anxious, right? So something or the other was missing. So I didn't know what to do. So what to do in such cases? What to do when you're not seeing one remedy that is fitting everything? What to do is to start small. Start from the chief complaint. Okay, start from the chief complaint. So what do we see in the chief complaint? We see that the patient has recurrent kidney stones, correct? But then there is also a specificity to it. What is it? Anybody? It is always on the
So he's on the left side.
left side. So
And-
left kidney stones.
And he has problems urinating and can only urinate if he bends forward.
Correct. So first thing I observed, recurrent left kidney stones. Second thing I observed, even his present complaint is something to do with urinary tract. Now he has prostate cancer. Previously he has kidney stones. So all his complaints seem to be in the urinary tract only, past and present. Yes or no? So definitely. Now, first thing from the last case I learned that whatever I have to treat, it has to have a special affinity for urinary tract affection. That is very clear. It is very strong. This location is very clear and strong in this patient. Then I look at what are the characteristics in this location. Two characteristics we found. First is left-sidedness, and second, like Lisa pointed out, it is better by bending forward, only by bending forward. And then if you open the repertory and if you start searching for left kidney affinity, so let me open Phatak. I open Phatak's repertory and I say kidney. Hello, kidneys, and then I say left. You see, there are only 5 remedies. Okay, sorry, you can't see my screen. Huh? Just 1 minute, I'm sharing my screen. Okay, can you see this rubric from Phatak's repertory? Kidneys, left affinity, right? So top remedies are zincum metallicum. Zincum is known for restlessness, etc., but not for anxiety. China, along with all this, you will have gases, prostration, weakness. We don't see gases, prostration. Colocynth, left-sided affinity, we know, but then the modalities are pressure, hard, warmth, etc. Mercury, there is mucus discharge, etc. Now, the last remedy is Parera Brava. Now, interestingly, if you read Parera Brava, you will come to this symptom of Parera Brava. It is cystitis, violent urging to urinate and straining, aggravated after midnight, can urinate only on the knees and bending forward. You see that? Then I know left-sided. And now my local symptoms are fitting. This looks perfect fit for the local symptoms. Yes, are you all there with me? Hello, hello, hello. Please reply.
Yes.
Yes.
Yes, yes.
So
Yeah.
then I think, okay, I reach the remedy from the local. Does this remedy fit the mental? Now I don't know anything, any mental symptom of Parera Brava. So what do? So I search for kingdom themes or the plant kingdom to which it belongs. And then I understand that Parera Brava belongs to the Menispermaceae family. And the top remedies for in Menispermaceae family are Cocculus and Parera Brava. Cocculus indica. You know, Cocculus is known for ailments from taking care of others. You know, nursing, no? Taking care of others, nursing, sympathy. This is what is the theme of this family: nursing, taking care of others, sympathy of others. I cannot see others suffering. Oh my God, that dog. Oh my God, my maid. Oh my God, that man on the street, he's bleeding. I am feeling too sympathetic. I feel like caring for them, wrapping up that dog and feeding it hot milk and really taking care of it. But what is peculiar is it seems too much, no? My God, who takes care so much? Huh? So that is very important in this Menispermaceae family, that they overcare, so much of caring that it is at their own expense, so much of wanting to work that my own body starts to deteriorate. My own body is fainting. I am dying. I have cancer, but I am not bothered about my cancer. I am bothered about your health, your suffering. That is characteristic of Menispermaceae family, that they are not worried about their health, but they are worried about others. Anxiety for others, not for self. For self, they are completely okay. Even if I die, no problem. But if somebody else is in problem, I have a problem. That is the main theme of Menispermaceae family. Then I understood that the mental symptoms, the local symptoms, the pathology, the cancer, everything fits in. So this is how this patient got the remedy, Parera Brava. He got Parera Brava 1M. I gave him 2 or 3 doses. He started urinating, and for 1 year, he had no complaint. As it is, this patient was not interested in taking any treatment for cancer. For him, only anuria had to go. So for 1 year, he did not even turn back to me also. After 1 year, he had a relapse, and then he got investigated for the prostate cancer. So with only few doses, his anuria problem significantly reduced. Correct? So this is my second case. What do we learn from this case? That first, it's not only enough to know the disease, but we have to also know the remedies. We have to have knowledge of medicine. We have to know all the different kinds of medicines that are available in our Materia Medica, all different kinds of knowledge for that medicine. You know, maybe little bit of keynote, maybe little bit of kingdom, maybe little bit of miasm, maybe little bit of drug picture. Every aspect of that remedy we should know. If we know all the aspects of the remedy, only then we will be able to choose the right remedy. Otherwise, what generally happens with us is we may give causticum, we may give arsenic with some understanding here and there. We fit in the bits and pieces. But actually, it is actually a complete whole picture. Every single symptom fits in. Every single symptom fits in. I am telling you this from practice. There is no one symptom that ever misses. If you reach the right remedy, no single symptom misses. That is what we have to achieve. For that, we have to have that kind of knowledge of medicine, knowledge of Materia Medica, knowledge of repertory, knowledge of kingdoms, knowledge of miasms. That is the second quality, knowledge of medicine.
Shrikant, may I ask a question?
Sure.
It's regarding the search. So I put in kidney stone, I put in renal calculi, but it doesn't, I mean, Pereira is one of the remedies, but it doesn't narrow it to 5. How did you narrow it to 5 when you did your rubric search?
See, Lisa, frankly, what I am doing is I am just giving you the last part of my search.
Yeah.
But to start with, obviously, I also go through the same process. I see those 5-10 rubrics. I'll make a list of all those remedies. And then I study all those remedies slowly, slowly. And then it narrows down.
Okay, thank you.
So you have to keep working. Homeopathy is for hardworking people, not for intelligent people. Intelligent people, they will sit and they will tell you that this is restlessness of arsenic only, this is causticum only. Arguments is for intelligent people. Those who want to find remedies, they will sit and burn the candle. Yeah.
Shrikant, another question for you. So the family, it's not, it's who, like, is it Yakir or is it Shankaran's analysis
no,
that gave you the
France
Mellitus?
This is from France.
Oh, it's Vermeulen.
Yeah.
Okay.
So you see, again, different authors' knowledge also. So Sankaran has not written anything about Menis Permisi.
That's why I was asking.
Yeah. So you have to have all everybody's knowledge. There is Massimo, there is Sankaran, there's Jan Scholten, there's Yakir. So many different sources of knowledge. That's the point, knowledge of medicine, knowledge from every single aspect. You have to have that thirst, that there should not be one symptom that I don't know of a particular remedy. Thirst to drink the ocean. It should not feel impossible. Oh, how can you drink the ocean? You should say, I will drink. Bring it. Okay, but it's not so difficult if you go in a very systematic manner. If you go in a very systematic manner, see, why I remember so much of symptoms, so much of remedies is because of cases. I've seen cases. Now today you have seen a case of Pereira Brava. Will you ever forget these themes of Pereira Brava? Will you ever forget these symptoms? So the key is not to sit and read. The key is sit and work on the patient. Burn the candle for the patient. Everything else just starts to fall in place. You will see suddenly you remember all symptoms. You don't get confused. You know which remedy has which symptom. Everything you will start collating rather than feeling lost. See more number of patients. That's the solution. Rather than sitting and reading Materia Medica or repertory. We will sit and read, we'll forget. Tomorrow morning, we will not remember anything. Okay. Should I move on to my next case?
Shrikant, I'm just wondering, it's 5 to 5 now, so we've we've spent a good long time, and the cases are really, really interesting. So this might be a good point to actually just be explaining how what you're doing and what you're teaching, how that fits in to the 6-month course that you are just beginning in September.
Yeah. So Mary, I have to finish in 5 minutes.
No, you can carry on, but most
Okay.
people here might have just only allocated an hour. So what I'm suggesting is that if we just mention what you're doing with the course, and then by all means you can carry on and do another case. You know, I'm not in any rush, and if other people can stay, then that's grand.
Yeah, so my idea was, I think, yeah, I wanted to do 3 and then talk about the mentoring, because then the relevance towards mentoring really becomes very clear. So
Okay, do you want to do how
I will just
long
do it very quickly. The last I'll finish in 5 minutes, and then I will explain. Yeah.
All right, is everybody okay with that? Brilliant.
Yeah.
Yeah, let's do that, Shrikant.
Yes,
Yeah.
please.
So the last quality is, no, it's not just enough also to have knowledge of disease and have knowledge of medicine. It is also equally important to know how to apply knowledge of disease and knowledge of medicine. For example, once I have a case of a 35-40-year-old male who was told that he has juvenile diabetes, and he comes to me with insulin injections. All of you know what is juvenile diabetes, right? So I'll just, if someone does not know, juvenile diabetes is type 1 diabetes, where the body does not produce the hormone insulin, which is responsible for uptake of glucose. If insulin is not there, then no glucose reaches your cells, then you start to collapse. So the only treatment for juvenile diabetes is external supplementation of insulin, because the pancreatic cells are dead. So there's no chance of regenerating those cells, and then you know, the body producing some insulin and you reducing the external supply of insulin. So when this case first presented to me, I thought this is a irreversible case. I cannot do much. All I can do is give some symptomatic relief, right? If he has some weakness, some etc. So this patient first came to me because he had gallstone colic. He was told that we have to operate you, but to cut the long story short, he did not want to get operated because his sugar was uncontrolled. If he would get operated, he would have infections and he would not recover. So there was no chance of operating. So that is when he came. I gave him the remedy Calcarea carb, after which he completely recovered. The gallstones went away. He started doing well. Since then, he said, any acute complaint, I will come to Dr. Shrikant. So he used to come to me. I have fever, please treat. I have stomach problems, please treat. And he was continuously there for me for one and a half year. After 1.5 years, what happened is I kept giving him Calcarea Sulf only. That was his late. From Calcarea carb, I shifted to Calcarea Sulf. I kept giving him Calcarea Sulf. The patient one day said, overall my symptoms are gone, but I am developing very severe skin eruptions. Okay. Let me show that to you. So you see, this is how his eruptions were on his legs. You see swelling on his hands. And just very quickly, I'm going to show you. See his legs. Ah, very bad shape. So this was there all over. Now, my initial thought was, see, if I'm giving a good homeopathic remedy and if the patient's internal symptoms of gallstones, etc., are reducing and patient is developing skin symptoms, in homeopathy, we are told it is a good sign, right? For patient to start developing skin symptom. So maybe I should not treat. But the patient's glucose level was not under control. It was 300. His HbA1c was around 6.57, not getting under control. So what to do? And I didn't know now what to do, whether to repeat, not to repeat. I repeated calcarea sulf in 1M. He had an aggravation. And the case was stuck. 10 days happened, 15 days happened. Patient is developing such, you saw how bad the eruptions were all over body. No single part of his body was left, all over body. I'm not knowing if I repeat, he's having aggravation. If I don't repeat, it's as it is spreading. And I didn't know what to do. Then I said, I have to read the disease again. Then I read all his disease, and then I read different types of diabetes, etc., etc. Then I came to know there are different types of diabetes, even in juvenile. So one of the type is Mody. Okay. This patient was diagnosed 10, 12, 20 years back about. Mody. And Mody is maturity onset diabetes mellitus. So patient develops diabetes at the age of 20. This patient also developed diabetes at the age of 20. Now, what is interesting is that if I get all this information, then I come to know that actually this patient is not having juvenile, but he's having maturity onset diabetes mellitus, because he develops diabetes at the age of 20 and not at the age of 7 or 8. So then I wanted to confirm. Then I did various investigations. I studied his C peptides, his Mody profiles, etc. And then I came to know there's one new enzyme which is known as C peptide. If you check that, it tells you whether there is insulin production in the body or if there is no insulin production in the body. Now, what is very interesting is no allopath had done this test. Everybody was treating him as juvenile because 20 years back, nobody has had this knowledge of there is something known as Mody also, juvenile also, etc. All such patients were diagnosed as juvenile. Just passed on. So I checked his C peptide showed that he has insulin production. So then I came to know this is a reversible case. This is not a irreversible case. So I told this patient, we will be able to reduce your insulin. Please wait. And then I shifted from centesimal potency to LM potency because he was having aggravations. So I shifted to LM potency. After I started LM potency, all his skin eruptions went away. And this is his latest photos. You see, gone. All skin eruptions are out.
Can you share your screen again, Shrikant?
Okay, you see this?
Yeah,
Completely
perfect.
resolved. You see this? Completely resolved. He had this all over the leg, back to normal. You remember the hand, no? See, back to normal. So, back to normal. So, what is more interesting, I will tell you, is what is more interesting is his fasting, you see, it came back to 96. It was around 130, 140 when we started. His BSL was around 300, I told you. It came to 140. He started having lower levels of blood sugar levels. So actually his insulin was reduced. You see, HbA1c should be around 6. It is around 4.6. 4.6 means it's very low. You have to increase this. So the allopath only, he said, no, I think something is going wrong. We need to reduce your insulin. From 24 units, now he is taking only 18 units of insulin. So the point I wanted to tell you is, it is not just enough to know or have the knowledge that skin eruption is good for homeopathic treatment, or that it is just juvenile, or it is just skin eruptions, juvenile, or to know that when to use which potencies, etc. So this combination of how to use which potency, when to use which potency, how to repeat remedies, when to stop remedies, how to take follow-ups, how to manage follow-ups, how to investigate patient, when to order which investigation, all this is equally essential. It is only when we collate all these knowledge together, that is when we will have good consistent results, where allopaths themselves will tell us, please come and treat our patients. Please, this is what happens to us over here. They refer us patients. They say, you please treat patients. We will refer you cases. And this is the intention with which we want to start with this mentoring course, where we want to make you people have these results, give these results, talk scientific language to patients, to allopaths, to everybody. What is missing there is, from whatever little I have seen, is lack of scientificity in the knowledge. We are only saying we'll treat symptoms. No, we have to treat symptoms. Definitely, our prescriptions will always be based on keynotes, mental symptoms, etc. But that is only our basis of prescription. But we have to know all of this. We have to become specialists. We have to be able to differentiate, investigate, and tell patients when to do what exactly is happening to them. We have to educate them what they have to tell their allopathic physician. If we are able to share and talk scientific knowledge, that will change the face of homeopathy. That is when we will be accepted as a science. And if any of you are really committed to do this and have good, consistent results in practice, which will be scientifically accepted, which will be undoubtedly accepted by everybody, you should do this mentoring course. If you have that kind of commitment, this is not for people who want to do it as an hobby. It is for people who want to give their life for homeopathy, who feel that I want to give this results. I want to really help my patients, and I want to really help homeopathy reach the masses. If you want to do this, this is what this course is for. So let me share with you what we will be doing through these mentorship program. Am I sharing my screen? No. Okay. So through this program, what we will do is we will train you. Okay. We will train you in a specialty. So not everybody has to have knowledge of everything. It will be too much. So what we will do is we will ask you to choose your specialty. So for example, you say, I want diabetes as my specialty. So we will put you through a whole program where you will know every nitty-gritty detail of what is diabetes, what is this disease, where to look for characteristic symptoms, what to investigate, how to follow up patient, how to know this is a risky symptom, this is when I should refer it to allopath, this is when I can still keep it with me. All this kind of training we will give you. And for this, initially, what we will do is we will have 3 phases. Before you enter this specialty phase, we will have these 3 phases. During phase 1, what we will teach is the art of case taking, how to elicit symptoms. That is the first art that is needed. How do you take a case? How do you ensure that you have explored the case from all levels? How you can find the characteristic, etc. That is phase 1. And during this, it will be your cases. During phase 1, you don't have to have cases only from your specialty. They can be from any specialty. But during phase 1, you have to bring your cases. You will present your cases. Then I will tell you, this is where you need to probe. This is where you need to focus. If you focus here, you will get the keynote symptom. Right? There will be lectures also before you start taking your cases. And then each case will be supervised, where you will present your case and then I will tell you where you can improve on it. Like this, day by day, you will keep improving in your case taking. Then during phase 2, once you have understood, okay, this is characteristic symptom, but I don't know which remedy has this symptom. I don't know where to search this symptom. I don't know from so much of data with regards to this symptom, which symptom or which remedy do I narrow down on? So how to study, how to evaluate cases, how to reach remedies. This is what we will teach in phase 2, how to really study the case, how to really reach remedies. That is in phase 2. And in phase 3, we will develop your knowledge, how to differentiate remedies. Okay, I reached this group of symptoms, this group of remedies, but I'm finding it very difficult to differentiate which out of these should I really pull down. Okay, now I am reaching to 4 or 5 remedies, but I'm not able to choose the exact one, the most precise one. This is what we will learn in phase 3, where you will really learn how to differentiate and how to reach exact rubrics, exact remedies, exact prescriptions. And then in phase 4, we will full on focus only on your specialty, where you will be fully trained from all aspects, clinical, homeopathy, case taking, everything. If you do 25, 30 such cases of your specialty, you will see that you will have at least 30-40% result percentage in your practice. Imagine, out of 10 patients, 3 or 4 patients of yours will always get better. 7 or 8, you will have to keep gaining knowledge. But if you do this 2-year program, definitely in whatever specialty you will choose, you will have at least 30% result percentage. And by result, I don't mean just amelioration of symptoms. I mean complete transformation of a human being in his pathology, in his mind, in his body, everything. His confidence improving, his energy improving, his blood reports improving, his parameters improving, everything. And most importantly, these will be scientific results. So anybody who feels that I want to commit myself to homeopathy and I want to dedicate my life to it, this is the course that you should do. And if you really do, you will really benefit from it. So that is what I had to share. Thank you, everyone.
And I've put a link in the chat there to that information. And I think also I can put Shrikant's email in there as well. So if you want to talk to Shrikant a little bit more about about this, then you can book a chat with Shrikant. You can also book a 15-minute chat with Shrikant from that website and from Shrikant's website as well. So if you want to find out any more information about it, then please do get in contact and speak to Shrikant. It is split up into 6-month sections, so you only need to commit to 6 months at any one time, and the start date is going to be September.
Yeah.
Has anybody got any questions about the course, about this way of prescribing, about why obviously we want to get homeopaths being more confident and getting better results?
Mary,
Yeah.
I think I heard that we can sign up for one phase at a time. So we can sign up for 6 months and
Yes.
then decide if we want to go on. And I assume that I haven't looked at the detail yet, that the prices are in the detail.
Yes, that's right. And the price is the same for each one, and it's just a monthly costing. So yes, commit to 6 months, see how you get on, and then go forward from there. So the first 6 months, you don't have to decide what your niche is going to be. The important thing is you're going to bring your really difficult cases to Shrikant and go through them in detail. That is what is appealing to me. And that is what, I want to get, because what has happened to me in the past is I get really difficult cases and I get really stuck. So I think, oh my goodness, I'm stuck here now. I'm going to pass this client on to another homeopath, somebody who's got more experience in this field. And then what happens is they don't report back to me what they've done and what's happened. So I don't learn anything by it. So how is that going to make me a better homeopath? I just don't think it is. Whereas this, I can really see is going to really, really help me get better results from those difficult cases. And if we all get better results from those difficult cases, as Shrikant says, nobody's going to be able to argue with homeopathy, are they?
Yeah. In fact, people are happy.
Yeah, too right. I'd be happy, if we're really helping people. The nice thing, I think as well, Shrikant, in India, a lot of people have a test beforehand, get homeopathic consultations, and then have a test afterwards. So you have got that. Okay, something's happened here, something's changed, something's different. And if we can just get in the habit of getting those test results before and after, it just means that we are going to be able to change how homeopathy is viewed. And of course, get everybody else telling everybody else about how homeopathy helps.
Yeah.
Does that make sense?
Yeah, I just want to share today afternoon, I saw a patient who is from UK. Okay, he has Crohn's disease. He was going to be put on immunotherapy when he came to me 3 months back. Today, forget immunotherapy, they reduced his steroids. Allopaths did. I did not tell. They themselves reduced. So this is very important. When they see that the Crohn's marker has gone down significantly, they have to reduce. It does not fit in their protocol. They only say something is happening here. We have to do. I have to change. They do a colonoscopy. He had ulcers all over the colon. They see there are only 2 or 3 ulcers left. That's what we have to give.
Now, some people might be a little bit nervous about niching, going for one disease. What do you think about that, Shrikant? Why are you saying that niching is useful?
because it will make your life easy to say. see all our biggest problem in homeopathy today is we are overwhelmed, firstly by the amount of materia medica knowledge, the amount of repertory rubrics, right? And then you want to overwhelm yourselves by saying, I will treat every disease that comes. Too much.
And I think that's why we need more homeopaths to be doing more niching as well. Because then if we know a homeopath who's used to working in diabetes or in cancer field, or in other difficult areas, it's much easier to work together and pass clients on. Is it just Shrikant we've lost? Is everything else is still working?
Yeah, I think so. Yeah.
Yeah. Okay. All right. So any questions? Does anybody worried about not having enough clients to make this worthwhile? Can you see the value?
Hello.
Yeah, so what do we do, Mary, if we don't have sufficient clients?
That's a very good question. What do we do, Shrikant?
Yeah, so should I first complete my answer to your first question and then
go for it?
So essentially, when we choose a particular specialty, it makes our life easy. Why? Because after you have seen 25, 30, 40 cases of one disease only, you will see that there are certain remedies which are coming up frequently. Correct? You will know that to give at least 50-60% result, I need to master these 15-20 remedies only. First, your target is so small. Second, because I have to study only one disease, I can go into the deepest of knowledge of that disease. No, I will know which symptom, what are the red flag symptoms, when to take risk, when not to take risk, when to investigate, how to show the world the scientific results, how to talk with allopaths. That is biggest thing, if you ask me, how to represent ourselves as a scientific homeopath rather than just saying I will give symptomatic relief. It is good, but we will always be seen only as relief. If we want to change this, then we have to know how to talk and how to walk the talk. So you will be able to walk the talk if you specialize, if you narrow down your thing. Then if you feel very hungry, you can always choose one more specialty. If you feel I have done a lot of Crohn's in the last 1 year, I have mastered it, now I want something else, you can always slowly expand, but start small. No, make your life easy, have more results, gain more confidence. If you see more results, you will only gain confidence, you will want to do more. That's what is.
And of course, we find on the internet, it's much easier to niche to get more clients, because that's how our clients are searching. So by forming a community in a particular niche, people can get to know you as an expert in this field as well. So the great news is that if you are building a community in a particular niche and can share these successes, of course, and for your next problem is going to be how to feel just too many people coming to you. So it's dealing with that growth of your business, of the community, and then where to go from there as well. So there's a lot for you to consider here. Do please book a chat with Shrikant just to talk it through, or one of the other homeopaths if you want to just discuss any issues, or please just send an email and let us know what you're thinking, what you're feeling about the commitment to do this, to make homeopathy your everything, really, your your whole business.
If people want to discuss even smaller ways of doing it, let's be open. We are doing it for the first time. Let people come up with their perspective. We will consider and see if we can work out something.
Okay. So I'm just going to have a quick look and let's talk about money and what it actually involves.
Meanwhile, should I answer Heather's question? Hello, Mary, should I answer Heather's question?
Yeah, Heather, go for it.
Yeah. So Heather said that what if I have less clients, right? So see, firstly, what I will suggest is try and get clients. When I started and when I did not have clients, what I used to do is I used to take up my relatives, my friends, my neighbors' cases, and I used to do them for free. That is one option that you can consider. Second option is, because we are a group and if everybody agrees, we can have these sessions as common sessions. All supervision cases also can be common sessions. So even if Heather is presenting a case today, all the others also can join so that they can learn from that case. So that is the second way. And the third way is, as I've said, if the patient is we are not able to come to a solution even after doing 1 or 2 supervising sessions with me, I am going to see the patient. During that seeing session also, you will learn a lot of how I am taking the case, when I am asking which question, why. I will let you know how I am thinking, why I am thinking, all that. You will be able to enter into the mind of a homeopath. That is very essential. If I was a student, I would really want to do this, frankly, because when I was learning, no homeopath was willing to share how he is thinking or what he is thinking, why he is thinking, what is the thought process.
So just a reminder that in the first couple of phases, Heather, they don't have to be in a particular niche. They can be any cases that you've got, and we can share cases then as well. So just to bring to everybody's attention, this is £180 a month. So your commitment is a monthly commitment. For that, you will be receiving personal supervision, group supervision, and obviously the lecture and the lesson for that month as well. So this is ongoing. This is actually going to be quite full on, because there's a lot to learn. But you will take it at your pace. But the intention, the bigger picture, is to actually improve the number of cases that you are really successful in your practice. Was today useful for you? Was it good to see how these cases are looked at and all of the little bits that we don't really address at the moment? If you want to just take yourselves off speaker and just have a little conversation, and so that we can understand what you're thinking and feeling.
It's very useful, also great to see. I think people are typing in the chat.
Oh, okay. We've lost you, Shrikant. We can't see you at all.
Yeah, I've lost my electricity, so no lights. You won't be able to see.
Okay. All right. Yes, it's been useful. It was also useful also to see the dramatic successes. I think that is what we are all surprised at when we listen to Shrikant talking, the complexity of the cases that he takes. And Shrikant has got a Facebook group, which you can look into as well, just to see some of his cases. And it's Homeopathy Supporting Cancer. So it's just a new group that he's just set up, but it's a lovely way to see how he is helping people, and you know, whether we can tune into a little bit of that and learn a whole deal more. Because obviously the more successful we are, the more clients we're going to have come to us as well. But thank you very much for your time today. You've been absolutely brilliant. It's now 5:30, so we've been going for a good hour and a half. Thank you, Shrikant. I don't know whether you can hear us or not.
Yeah,
I have recorded this session. So if there's anything you need at all, please do email us. Have you all, and I think Shrikant is going to just email his details to you as well. Let us know if there's anything that you need.
Okay.
That was great. Thank you.
Thank you. Thank you, everyone. Thanks, Mary. See you all.
Thank you very much.
Bye-bye.
Thank you.